The frontal lift. Nicholas, page 493, EOC, page 135. Learning objectives. Upon completion of this lab session, the student will be able to do the following. Describe the ideal physiologic respiratory motion of the frontal bones, list the steps of this technique and identify the endpoint, and correctly perform this technique on a patient. The frontal lift appears to place longitudinal traction on the falx cerebri as it lifts the frontal bone from the sphenoid. While the technique is performed, the physician may feel the sensation that the frontal bone is wobbling from side to side while being distracted before it releases and is able to resume its normal relationship. The effective performance of this technique rests on an understanding of the anatomic relationship of the frontal bone to the parietal bone, the greater wing of the sphenoid bone, and the temporal bone at the pterion. The principle of the technique is 1. To internally rotate the frontals to disengage them from their related bones, 2. To lift them anteriorly, and 3. Permit them to externally rotate and widen the ethmoid notch. Diagnostic procedure. Place both hands in contact with the frontal bone such that the index fingers are aligned on either side of the metopic suture and the other fingertips contact the brow ridges bilaterally. Palpate the motion between the left and right halves of the frontal bone as you palpate the rate and amplitude of the inherent motion of the CRI. As the head moves into flexion, the frontal bone or bones should be felt to flatten anteriorly and widen laterally in external rotation. As the cranial base moves into extension, the frontal bone or bones should be felt to narrow laterally in internal rotation. Identify motion restriction. The treatment. Physician sits at the head of the table. Patient is supine. Number 1. The physician rests elbows on the table. Place the hypothenar eminences on the lateral angles of the patient's frontal bone and interlace the fingers over, but not in contact with, the forehead. Number 2. Attempt to draw the fingers of one hand from the fingers of the other, yet at the same time gripping the fingers of one hand with the other. Action of the lumbrical muscles. In this way, the hypothenar eminences exert an influence of internal rotation on the lateral angles of the frontal. Number 3. Coordinate this action with a lifting of the frontal anteriorly toward the ceiling until the lateral angles can be felt moving into external rotation. Number 4. When the frontal bone appears to be in the midline and has been released anteriorly, it is slowly allowed to settle back to its normal relationship. Number 5. Gently release the hands from the patient's forehead and reassess.